Vulnerable NDIS participants are going missing after being lured from their homes and hospital beds by unscrupulous providers chasing access to million-dollar taxpayer-funded plans. Participants with drug addictions, complex psychological disabilities, or intellectual disabilities have become easy targets for these providers. Solicitor Charlotte Jones, the Chief Executive of Mental Health Legal Centre in Melbourne, estimates there are probably thousands of people missing in Victoria alone, and has slammed the government and police for failing to prevent people from being exploited. In 2023, the Mental Health Legal Centre in Victoria shared a report with government and relevant authorities, highlighting the problem of people going missing. In 2024, the Office of the Public Advocate in Victoria voiced concerns with the NDIS regulator around participants being bribed and how NDIS policies and legislative frameworks have incentivised the use of manipulation tactics among service providers. It was reported that rogue providers had been hanging around outside supported residential services homes touting for business, with some going into the homes as early as 4 a.m. in the morning to tempt participants out. It was believed also the security guards at hospitals were working for providers. Once the participants have left their old provider and signed up with the new one, they can often find themselves being moved from one private rented property to another, sometimes losing contact with people who care about them. An NDIS whistleblower in Melbourne recently voiced her concerns about a client with an intellectual disability who was tempted to move to another provider and was no longer contactable. Some of these NDIS plans are worth hundreds of thousands of dollars, with boarding houses, housing commission homes, and family homes becoming hunting grounds for these providers. Although names of victims had been given to police had initially dismissed the crimes because these cases were regarded as civil matters. A News Corp investigation revealed that registered NDIS provider Lifelink Care allegedly lured at least 6 NDIS participants with mental health, learning disabilities, or addictions from 3 different boarding house-style facilities in the last year. One participant, we will call John, is 45 years old, but has the mental age of a 6-year-old. He would not normally leave his beloved Bluey toy or his clothes, but he was allegedly lured into a black Nissan outside his supported residential services home in May of 2026. His only family is his mum, who like him has complex mental health issues. They're both on NDIS plans worth thousands of dollars. The owner of the Nissan is Mehdi Siddiqui. John's previous provider was not able to contact him. The next day, John's mum was picked up from another SRS facility. A central tenet of the NDIS is choice and control, so John has the freedom to choose to move to a new provider at any time, despite not having mature decision-making capabilities. It is believed that Siddiqui offered to buy John fast food and promised him his own apartment if he left his current provider. Mr. Siddiqui is the co-director of Lifelink Care, a registered NDIS business set up in 2023. According to the whistleblower, John had heard about Lifelink Care from former SRS residents who had left their old providers and moved across to Lifelink. One former resident had been recruited to go into various SRS homes and hand out Lifelink Care cards. In just 24 hours, Lifelink Care had landed 2 new clients. SRS staff believe about 6 participants had been poached in the last year. It was later discovered that John and his mum were taken to Eltham Gateway Hotel and Conference Centre on the outskirts of Melbourne. John was happy because he was living with his mum, despite a public guardian previously stating that the pair should not live together for safety reasons. Mr. Siddiqui had not completed a handover with the previous provider before moving John, so he was unaware of his background or health needs. When questioned, Siddiqui later admitted he didn't know John was on medication for cellulitis. Another NDIS participant poached from an SRS by Lifelink Care was a lady we'll call Sally. 29-year-old Sally has complex health needs and a history of substance abuse going back to the age of 14. She is on a $169,000 a year plan. Sally had been living at the same motel on and off for 5 months, proudly showing off her new jewellery and designer sunglasses. Her sister, living in Queensland, had previously worked closely with Sally's support workers. When she contacted Lifelink Care, she claims they wouldn't give her a straight answer and refused to share the company's ABN, NDIS registration, their qualifications, or any surnames. In some cases, these participants were being moved from place to place so they could not be found and were given incentives such as cash, cigarettes, and alcohol. One man in his 20s on $1 million a year NDIS package was lured away from his existing provider and moved from property to property for years. Miss Jones believes NDIS participants are being picked up outside and inside their group accommodation at all hours of the day and night, even from their hospital beds, by people desperate to get their hands on their taxpayer-funded $1 million plans. The NDIS watchdog confirmed that providing inducements was against the NDIS Code of Conduct, and if found to have occurred, could result in a provider's registration being revoked or banned. According to ASIC, Lifelink Care is being struck off the registered. However, Mehdi Siddiqui's ABN is still active.